A common vitamin called niacin may increase the risk of heart disease, a new study suggests, though complete elimination of niacin from the diet isn't necessary, and researchers say more regulation may be needed. The main takeaway is not that we should cut out our entire intake of niacin. That's not a realistic approach. Stanley Hazen, senior author and chair of cardiovascular and metabolic sciences at the Cleveland Clinic's Lerner Research Institute, said in a statement. Given these findings, a discussion over whether a continued mandate of flour and cereal fortification with niacin in the U.S. could be warranted. Scientists discovered in the 1940s that niacin deficiency causes a deadly form of malnutrition called pellagra, so they began including the vitamin in foods like flours and cereals, according to the National Institutes of Health. Around 3 million Americans contracted pellagra, and 100,000 died between 1907 and 1940. Doctors began using niacin to treat patients with high cardiovascular risk and to lower low-density lipoproteins, LDL, cholesterol, but more recent studies found the vitamin offered disappointing results. This caused researchers to conclude it had no beneficial effect on patients already taking cholesterol-lowering statins. A previous study suggested a link between niacin and inflamed blood vessels after some patients taking the vitamin continued having strokes and heart attacks, even though the niacin lowered cholesterol levels. The complex relationship between niacin and heart health has left scientists perplexed for years. Despite niacin lowering of cholesterol, the clinical benefits have always been less than anticipated based on the degree of LDL reduction, which led to the belief that too much niacin came with unclear adverse effects, Hazen said. However, the researchers believe their new findings better explain this relationship, and why investigating residual cardiovascular risk is so critical. Niacin is a water-soluble vitamin, meaning the body doesn't store it, according to the Mount Sinai Health System. High niacin levels can cause headaches, diarrhea, gout, dizziness, blurred vision, diabetes, rapid heart rate, upset stomach, itching, liver damage and flushing of the skin. Serious side effects are more common if between 2,000 to 6,000 milligrams of niacin is taken a day.